Thank you, Kelly. Next slide, please. Just as another reminder, we are recording this presentation. An email will be sent in the next 3 days, and please complete the survey at the end of this session. And that will be sent within the webinar, within the survey, within the email, follow-up email that will be sent in 3 days. Next slide, please. And again, a reminder, the Q&A button on the bottom of the Zoom screen and the chat button is available as well. And we'll be monitoring these throughout the presentation. Next slide, please. And here we're here to welcome Richard Connect, who is the Integrated Services Advisor for the California Department of Social Services. And I'll pass this on to him. He is our moderator for this morning. And thank you, Richard.
Rainey, thanks a ton. Good morning, everybody. Pleasure to be with you all. Hope your Wednesday morning, or in case you're on the East Coast, the afternoon is progressing well. Been a pleasure for me to work with the department on a number of issues the last few years, and really happy to be facilitating the conversation today. Let's introduce you first to our panelists, and if we can get the next slide. Michael Finley is a member of the executive leadership team. You have met him previously if you've joined us in our prior webinars. He's with the W. Haywood Burns Institute. His work involves strategic planning, organizational development, financial oversight, project development, and managing relationships with community leaders across the nation. He has nearly 2 decades of experience working to reduce racial and ethnic disparities on a national policy level and in local jurisdictions. He joined the Burns Institute in 2001 as a site manager. He has helped to develop the Institute's site-based strategies and tools, including their readiness assessment consultation. Most recently, Michael served as the director of the site management, where he supervised the Institute's site-based work, trained new site managers, and conducted hundreds of disparities-related trainings across the country. He has done similar inspiring work for the state of Maryland, and he began his legal career as a Soros Justice Postgraduate Fellow with the Youth Law Center in Washington, D.C. And while there, he was involved in reform litigation and policy work focusing on improving the conditions of confinement for children in state custody and racial and ethnic disparities in the youth justice system. He is a recipient of a number of awards for his advocacy work on behalf of children and is a proud graduate of Morehouse College and the George Washington University of Law. Michael, really happy to have you with us. Grewal-Kök is a Senior Policy Analyst at Chapin Hall, where her expertise is in early childhood and child welfare research, policy, and advocacy. She is co-leading the development of Chapin Hall's resources on economic and concrete supports. Well-being.
I apologize, Richard. There's some connection issue, I think, on your end a little bit. There's a little bit of background noise happening. Can we start over with Yasmin? Can you do a new introduction for Yasmin really quick?
Sure. And I'm on a hardwire, so there shouldn't be any challenges with my connectivity. Maybe it's a paper shuffling issue, but apologies for that. Happy to welcome Yasmin Grewal-Kök, who works at Chapin Hall as a Senior Policy Analyst there at the University of Chicago. Her expertise is in early childhood and child welfare research, policy, and advocacy. She is co-leading there the development of resources on economic and concrete supports as a core component of child and family well-being systems. Yasmin is an attorney with over a decade of legal expertise in both private and nonprofit sectors. Prior to joining Chapin Hall, she helped to lead the policy and advocacy agenda at Early Edge, a nonprofit organization dedicated to expanding high-quality, publicly funded early learning programs in California. She holds a Juris Doctorate from Berkeley Law at the University of California, a Master of Education in Early Childhood Ed from the University of Hawaii at Manoa, and a BA from Duke. Her previous research has focused on effective multi-system collaboration to promote the educational experiences of young children in foster care. And happy also to welcome Cheryl Treadwell, whom you all know, at least by name. She has spent more than 2 decades at the Department of Social Services across a broad set of initiatives. In April of 2021, she was appointed as the Chief of the Safety Prevention and Early Intervention Branch, which focuses the state's efforts on the front-end reforms of child welfare systems continuum, including primary prevention, among other issues. Her education spans both the social work and legal field, along with her experience working in the community and in the human services for more than 30 years. Cheryl has represented the department on the California Behavioral Health Planning Council, and she is currently co-leading the division's racial equity work group. She's the proud mother of 3 wonderful adult children who are the heartfelt impetus behind her work in this field. She has experience as a foster and an adoptive parent, and continues to be a strong advocate for persons with intellectual disabilities. And she volunteers in her community and church, and when not working, which is rare, she loves to hike. So please join in a collective welcome for Michael and Yasmin and Cheryl, who will be our panelists today. Really happy to have all 3 of you with us, and good morning. All right, let us move to the next slide if we can, Kelly. And just, we thought we would just spend a moment or two just kind of giving us a summary, if you will, of our learning and our conversations we've had in the prior webinars. And so if you have not been with us, this will kind of orient you or set the table a little bit for our conversation today. And if you were with us in the prior events, it'll give you a chance to just summarize. But we have been enriched in the prior 3 sessions and informed by a number of subject matter experts, some of whom are rejoining us today, who have collectively raised our awareness about current and historic child abuse, child protection and welfare practice in California and across the country. In those prior sessions, which we hope you enjoyed, we have explored child and family policy in a historical context, including a recognition for many about how current approaches to child welfare are rooted in deeply ingrained social policy that has supported the disruption of families of color through slavery, land theft, assimilation, and other events and factors. We heard how the national model became a system built on discriminatory design, really, and a priority for surveillance and policing of poor families. We have explored in depth the impact of white supremacy culture as manifested in many institutions, including our media. All of that has collectively and ultimately rolled up, if you will, into deep manifestations of structural racism and policy and interventions that advantage white people and create adverse outcomes for everyone else. That history, of course, can be tempered on some level by solutions, which we've talked about here. We've explored some of those, and of course, those need further discussion and merit, and that's part of our conversation today. These include a recognition of the characteristics of white supremacy culture, including those that shape each of our own biases that we bring to this work. We have heard compelling evidence about the efficacy of replacing othering with belonging as a kind of a mindset or a framework for approaching the work of child protection, and preserving biological connections rather than finding surrogates. We've explored some solutions born out of the now 3 decades long development of welfare informed systems of care, if you will, and wraparound-like approaches that lead us to understand that the power of centering the work in community, recognizing that those closest to the issues have the solution most often. We've talked about the sharing of power that comes when we authentically engage impacted families and communities in co-designing strategies and making decisions, sharing power authentically. Finally, we identified how anchoring the work in trust, transparency, shared visioning, and in working agreements by and between systems and those being served are most effective. Kelly, let's do one more slide by way of catching folks up. We've come to understand in our prior conversations about the fact that research has demonstrated that significant poverty creates undue high risk of investigation and involvement of Child Protective Services authorities. While issues like substance abuse and domestic violence are thought to be high correlates to child maltreatment and reporting, the most reliable economic predictors of child welfare involvement include income loss and employment scarcity, cumulative material hardship, and housing issues or hardships. That and other data affirms for us that Black families are far and away more likely to experience poverty than white families. And we have heard compelling evidence about also some very effective ways to reduce child poverty and therefore risk of and the need for child welfare involvement, including the types of policy or practice that you see listed here in the second half of this slide. Some very thoughtful policy and practice conversations that have that I'm sure we'll explore more a little bit today in greater detail. So with that as kind of a catch up and high level reset for our prior three events, we would love to again remind you that we see this as a dialogue today, and we hope that you will avail yourselves of the chat function and place your questions and inquiry into chat. We have a number of questions kind of queued up for our panelists, and we'll turn to those now if we can, and just begin the conversation. And we'll turn, I think, to at this first slide. Let's just open this to whichever panelist would like to step into this first part of the conversation. But in light of the emerging efforts and opportunities in prevention, and with a focus on community-wide or system-wide impact, what are your thoughts about what alignment means? We think we might want to help ourselves kind of collectively define what we mean by this term alignment if we're going to talk about it in some depth. So what does alignment mean? And then how does alignment and partnership enhance or support access to the kinds of concrete material supports that we've been talking about, particularly from an interagency standpoint? Anybody want to lead out for us on this one?
I'll jump in. So keywords in my mind come to mind: collaboration, integrated service. Honestly, the first thing I thought about when I thought about alignment, you think about alignment of vehicles. So you know, let's run with that analogy for a moment. You think about positioning the wheels properly so they can line up with a bigger system of guidance and steering. So it must be all fully aligned and operative, but they don't all function well without the other. So the results are varied if you don't do that. So when you think about the intersections of various systems and how they intersect in the lives of families, if you look at it from a community view, sometimes they're not very coordinated. So the world that we're trying to move towards in the prevention world now is to move more toward an integrated, coordinated, aligned system. So we're all heading in the same direction. I like coordination versus alignment in the sense that you are able to organize your work or the entity so they're able to work together effectively. And systems of care is an approach and a framework that allows you to do that kind of coordination and care. And it allows you to look at it at the state, county, city level, local levels in a manner that, it'll improve the lives of families by being more coordinated and not misaligned and disjointed, so families can make informed decisions and choices.
Cheryl, thanks. I'm sure we'll have a chance to kind of dig deeper on this idea around systems integration and how prevention efforts are supported. Michael, can we invite you next to reflect a little bit on what alignment means based upon your work, maybe in other jurisdictions?
Yeah, so I think how Cheryl captured it makes total sense, and I see that. And for us, because we focus on disparities, right? We're thinking about racial, ethnic equity issues within the context of the things we're talking about. Alignment also for us is when you're saying integration or coordination or collaboration, right? Who is part of that, right? So also just thinking of alignment of really how do we align our values and how do we set the right table? So for us, it's how do you engage in, in this case, families, young people, as much as possible in helping develop that alignment, in helping define that alignment. And so just it's an add-on to what Cheryl said. Is it's really thinking about right, and we get into it. How do you really? What does that look like? Because that's not a natural space necessarily for institutions to play in. It's not how they were designed, right? So how do you align with, and how do you establish and align yourself with the values of those, again, most impacted by the issues we're dealing with?
Yeah, thanks for that. Yasmin, thoughts about alignment?
Yeah, just following up on what Cheryl and Michael said, which I very much agree with. You know, I think we often think about alignment across systems, across state agencies to break down silos and better support families. I also think we need to think about alignment with communities and with families. Because in the end, we really need to understand what do families need if we want to meet their needs and better support them. So I see alignment in kind of in two different ways, across government systems, but then with families, with communities, with the counties in California.
Yeah, thanks for all that. And what seems to be emerging then thus far from your reflections is at least two types of alignment, right? There's an alignment of values, vision, mission, and then what we might consider more structural or programmatic alignment of how the organizations actually will work together, and then how those organizations will engage with community. Are we hearing that right so far? Okay. Appreciate that. Can we reflect a little bit sometimes when we, in California in particular, where we are kind of richly endowed with financial resources that some states really only dream about, is there an opportunity to reflect a little bit more maybe at this point on alignment of those organizations financially? So it's not just programmatic, but there's got to be a financial relationship to how they fund prevention services, right? Or the supports that we're talking about. So any additional thoughts in terms of alignment specific to maybe the dollars that underscore or underwrite our work?
Yes, I'll start with that one. Well, of course, currently, our current effort that we're doing with our state prevention program that aligns with Families First Prevention Act gives us a chance to sort of look at how we can leverage and align resources across agencies and then the larger safety network of public benefits in terms of that funding. It gives you an opportunity to look at how we might leverage those types of programs that serve the communities that we have in common across public agencies. When you think about child care, public health, our SNAP programs, child welfare can't do this in a vortex. So it means that the silo funding has to look very different when we're talking about reimagining our system in the way that we've been discussing over the last several weeks. Then you think about the current opportunity around the 2083 work, which is the whole systems of care approach that was initially developed for the back end, the complex needs care, kids in care, but it makes sense that those same teams move that work up front, and also with the correlating fiscal partners that would need to be at the table to have those kinds of discussions. So there are opportunities now, and it's not easy work because those funding sources tend to be so categorical that they don't allow a lot of that flexibility. But when you're doing the transforming work, to me, you have to think about things outside of the lines. You have to really get creative and take some risks. And I'm sure fiscal people hearing that will probably have the hairs raised on their neck. But my point is that sometimes it takes a little bit more of that thinking outside of the box in terms of how we come together on the shared interests, shared values, and when it comes to the money, the same way. Sometimes the buck stops there, as they said, the line gets drawn. Oh, no, you don't get my money. But we're serving the same population, so it's having that kind of conversation to be able to leverage. And I think we have a prime opportunity right now with our prevention work to lay that groundwork down, and with our systems of care work to lay a pathway to do those local prevention efforts.
Thanks, Cheryl. Yeah, there are other opportunities, which I'm sure we'll get to in just a moment or two as well, that we can maybe hold up as opportunities to leverage the dollars. I think, Michael reflected earlier on the kind of unnatural act that it is to blend dollars, because everything comes categorically, and this is one of the major obstacles. Other thoughts from Yasmin or Michael about the financing alignment, if any, before we move on?
No, just I was smiling to myself because we have at Burns, we talked about these 4 conundrums that we kept bumping into in our work. And one of them was this: it was the government's not designed to really deal with have to be flexible and to deal with the complex issues that humans have, right? And so this is, so I agree with everything with what Cheryl said, and that then what we have to navigate and dig into is really that, how do we do that? And I think there's oftentimes, we do a lot of workarounds to try to address it, but not deal with it. And we just think, well, how do we really dig into these structural issues that are actually part of the challenge? So just that's the work that needs to be done.
Yeah, thank you. Yeah, not easily done, right? All right, let's put the next set of questions up, Kelly, if we can, and kind of transition a little bit from kind of defining alignment to thinking a little bit about the opportunities for alignment. Cheryl's begun to call out a few of these specific in California, and there are others that we might highlight as we get going, but I wonder if we could maybe first turn to Michael on this, if we might. And as you think about your experiences or those of your colleagues in other states in particular, Michael, we might be interested here in California in knowing what you feel are the current or recent opportunities for alignment, and if you've got examples that you can call out for us.
Yeah, So the one I'm thinking of right now is work we're doing in Ramsey County. So this isn't exactly, it's all systems, so it's cross-sector there. But Ramsey County is a site where we're doing like a learning community. We're calling them a learning community. We're doing this work around how do we dismantle structural racism. And from that, they have a cross-sector grouping of systems and community folks at the table to just try to look at all of these barriers. And so as part of that work, one of the things they did as a precursor to what's coming was just government-wise, they went from like 20 some odd different departments to 4. So they had a larger structural change that they did to really try to make themselves more efficient. And so shrinking down to sort of 4 categories of agency. And now part of the conversation is we're engaged in a process where we're deconstructing their child welfare system with child welfare at the table. That's just the first system that said we're open to look at everything we're doing. And as part of that, those budget conversations are just beginning. So there's like pieces to it. The first is them being vulnerable enough to say, we're open to the group interrogating our stuff, our process, how we screen, how we report, just everything we're doing. And we're trying to, we're starting with screening and reporting. As part of this, they're looking at, hey, where do we refer people to? What are the resources we have? And so they're beginning to just start those conversations around how we braid funding differently. But the hardest part, I think, is being able, and I think the value of the work, what we're learning is their willingness to engage in just that conversation, period. Because there's no incentive if you're a director of an agency to engage in that. There really isn't. You don't get a pat on the back. No one gives you a great award for, trying to figure out how to use your money, your budget more efficiently. So I'm uplifting Ramsey as a place where we're starting to tap into that conversation, specifically around the financial part as being an aspect of how you actually address real structural and real transformation, structural change.
Really appreciate that. Michael, can we unpack that a little bit? In the course of their conversation, are the constituents in Ramsey, is this related to their opportunities under FFPSA? Is that part of the conversation, or are they, or did it start before that and we're not yet connected on it?
It started before that. That will come up because it's just part of what they do. But yeah, it really started as a system-wide, cross-sector again of stakeholders and community saying, we are open to exploring how structural racism has impacted all these systems which we know impact communities, particularly communities of color. And child welfare stood up as part of that journey to say, we will be the first of the systems to be open to being interrogated and deconstructed and figuring out, so it's a real experiment, but they're betting on themselves. So it's really still early in that. Now, this is a 3-year-old process. So it's not that it's new, but it's the work of how you get into these and getting to this level of detail of the conversation around the real stuff, the meat of budget allocation, reallocation, how you distribute all of those pieces.
Yeah, super complex work for managers and leaders in those kinds of organizations to come together consistently, to have those re-engineering, reconstructive questions in the midst of trying to deliver services at the same time, while challenged by workforce issues that are kind of unique at the moment. So kudos to your partners in Ramsey, and thank you for bringing that forward. Yasmin, what are your early thoughts about current or recent opportunities for alignment here?
I think alignment requires, first off, a shift in your mental models of how you want to serve families. And we're starting to see that more and more across the country. And I think Family First is an opportunity, a catalyst for us to get there, and requires comprehensive coordination across systems. So child welfare, probation, mental health, public health. And so I think that is key to moving forward with alignment. In terms of other things that I'm seeing, I'm starting to see more states want to kind of move their systems in that way, even beyond what Family First requires. For example, Vermont has what they call an economic firewall. So child welfare works closely with their TANF and early childhood and care systems. And any family that's kind of brought into an investigation for neglect is almost like moved and diverted towards TANF and other family support services, so they don't come into the system. So I think there are states that are thinking innovatively about how to do that. And California has linkages. I think there's a lot of potential there to coordinate between family support, TANF, and child welfare. I've also seen other states start to think about kind of universal eligibility for public benefits, a one-stop shop for families. So I think there's a lot of really exciting work happening across the country.
Yeah, thanks for that. Appreciate you reminding us about linkages, which is, I want to say, 15, 18-year-old initiative now, at least in some counties in California where they were kind of pilot testing for us. Thanks for that. Cheryl, you began to make reference a few minutes ago to the systems of care work. There are other kind of primary and secondary prevention opportunities, if you will, that potentially can get us to a place where we can deliver material, concrete supports that are needed in California. Do you want to spend a minute or two calling out any others? I'm thinking about the CalAIM work on underneath the community supports, or what they used to call in lieu of services, things like that kind of get us to what Chapin has been championing, which is getting people material supports as a way of, it's almost pre-prevention, right?
Yeah. I mean, your CalAIM is the Medi-Cal managed care integration approach, a holistic approach to reforming that system. That is a tremendous opportunity when you think about health and mental health and providing access from the community viewpoint, because we know what we saw in COVID is there was a lot of disparities there and access was very, very limited. So it's very timely that California is taking it on itself to sort of look at that, hopefully with a better and deeper equity lens. But just to say a little bit about the CalWorks program. As you said, that has been a long standing program, but data is important. And, we had an evaluation released about our CalWorks home visiting program. And so, for example, it didn't result in increased referrals to child welfare services. Less than 5% of those CalWorks home visiting participants were referred. And the vast majority of the referrals that we did receive, they received family support around like food security, where they were referred to food banks. 91% of those folks were referred to accessing material goods, like they needed car seats, cribs, other essentials for new moms. So it just sort of shows you, if you make that investment up front, what's important in terms of keeping families out of systems when they're under stress. That's why we're looking at moving, that limit of material goods support to a higher level. Is that a good investment? Yes, absolutely, because the data is starting to reveal that. And additionally, we're seeing that, a lot of those families in this program didn't re-enter the emergency shelter system. So they were able to find supports to remain stable in their homes and in the community. So some data is coming forward to reveal that there is, benefits to making those kinds of linkages and investments early on in some of our programs. The latest, I think, is the initiative with the California Youth and Behavioral Health Initiative. I think that's the latest one that's been announced in terms of really looking across our departments around cross-system support and collaboration around behavioral health. We've really seen onset, even during COVID and post that, the rise of suicides and young people, adolescents, really, coming forth with very severe mental health issues that it was already a problem before, but even more exacerbated by, what's happening now. And so, those are areas for us to be able to come together. And I think the prevention planning teams that are together under FFPSA have a tremendous opportunity to, map these assets and sort of make some assessment of where their gaps are. And of course, all of this, to me, is if you're transforming, you're going to have to really look at, what Michael's talking about in terms of the structural barriers to that around racism and how that gets unpacked with these efforts too as well. So that's just to name a few, and I think just agreeing with what Yasmin said too as well. So.
Thanks, Cheryl. And this might be a place to, at least for the attendees, to maybe brainstorm really quickly as a panel, the unique opportunities in California that we haven't talked about. There's a 20-year-old Mental Health Services Act that has prevention, early intervention resources in every county through the Behavioral Health Authority. In addition to the Behavioral Health Initiative that Cheryl just mentioned, there's a $3 billion investment in the development of community schools through the Department of Education. Those community schools, if they're well structured and implemented in a way that's really community-centric, they become hubs, if you will, for the delivery of concrete supports for at-risk families, and thereby preventing and or diverting from system involvement. I think of some of the multi-tiered systems of support work that they do in our schools that can also have an early impact in terms of empowering families and keeping them in community and away from systems. So there's just this rich tapestry in California that, well, first five, of course, right, are tobacco monies that other states, like most other states, don't have those kinds of resources either. So while we sometimes get lost in a conversation around scarcity of prevention dollars, it's just not the case in California. We've got a rich vein or veins of opportunity to help us address the challenges. Any other thoughts on examples of current opportunities or alignments before we begin to explore what some of the challenges are? All right, let's cruise to the next slide, Kelly, for a moment or two, and maybe we can invite Yasmin to lead out on this, given your experience with your partners at Chapin and other places. Can we begin to explore what keeps alignment from being present? And of course, we've done this on some level in our prior conversations, but maybe unpacking that a little bit more. There are really two ways to address this question. A second way might be, what are the obstacles to doing our work in a more aligned manner? And then I'm sure as we explore these two related questions, we'll begin to find some examples from the field about how we're addressing those obstacles. Yasmin, some early thoughts about that?
I think we mentioned quite a few already. I think that unfortunately funding streams often are barriers to alignment, as we had discussed, and there needs to be very intentional kind of planning and thinking about innovative ways to use funding to support alignment. I think one thing we didn't touch on is the idea of data systems and IT. I think that in order to be truly aligned, you really need to have data sharing agreements and data systems that work across agencies. And I know that California is making progress in some ways, but it will take time, it will take funding. And there's a lot of hesitation sometimes to share data across systems because of surveillance concerns and privacy concerns, which have to be really taken into account. And there are ways to kind of firewall or kind of protect the integrity of some of that data, because what we don't want is for those shared data systems then to bring more families into the system. So those are kind of the first things that come to mind as barriers.
Yeah, thanks for that. Yeah, data is a huge challenge in California. Cheryl or Michael, thoughts about what keeps us from being more aligned? What else?
There's always, each entity has their accountability and reporting requirements from the many funding sources. And sometimes that prevents people from looking for the commonality when they're serving the same population. They have this perceived perception that we have a barrier, that we can't serve the same families, but you can. It's just getting past that mindset or perception. How do you do that? But then looking also at sort of the barrier of how the governance structure is set up. This sort of goes to like, when you invite the community in, who's really sitting at the table making the power decisions about, does the community feel empowered? It's like, okay, I'm here, but at the end of the day, are you really truly going to listen to me? About how I view, your help in my community. Is there really a no wrong door reality when it comes to accessing services? That's what we say, but from the perception of the community, does it feel that way? And so it's just working toward that common shared interest. And do you set your governance structure up in a way, or whatever the structure is, to be able to do that sort of no wrong door reality for allowing families to access services? So it's just a thought there.
Yeah, and I would just add, there's something about, because the first list around the funding streams, data, challenge around sharing data, reporting requirements, right? Those are right. That's like, that again is in the operations. Those are those obstacles. And I think zooming out, institutions have culture, and this all requires a culture shift. So we'll continue to repeat, this will be my theme, is, how do you develop and when Cheryl said the common shared interests, we don't common shared values, because if you start there and do that work, which again is not what as professionals in systems, it's just not like how we show up. It's just not, right? We can, but it's not natural in that way, right? And so how do you spend time having those conversations on values, which I think allow you to more effectively address those operational pieces, which absolutely are critical. And I'll just give one example. Again, it's not perfect alignment, but just to give you a sense. In Ramsey, the first grouping of people we worked with were like child welfare, justice, the county attorney's office, like sort of your traditional systems folks in that way. as they finished the 3 years of working with us, what they said is, we can't actually do anything. Like, we can all want transformation. We have to hire people. And so if we don't have HR, procurement, contracts, the assessor, like housing, parks and rec at this table to go through the same journey, we're missing something. And so it's a lot of words to say. Somewhere in here, what they were telling us is we all have to have some shared values. All of us gotta have to be connected in a different way, in ways that we're not comfortable with, to then address all of these things that you all know in systems are the pieces that we have to adjust. So there's like a first conversation almost that we don't like to do because it's not what we like to do, So I'm gonna put that out there.
Yeah, thanks for that. Super critical. I think to your point, the programmatic alignment and the alignment of the financing and the data systems that we've been talking about only becomes possible when executive leaders and managers can, to your point, approach the culture change, right, organizationally. And that demands almost a re-identification of oneself as an executive or a manager from, particularly in welfare and behavioral health and probation, where we see ourselves as interventionists. Like after an event happens, then we can statutorily intervene, right? And in reality, to get to prevention, we have to somehow help ourselves and our partners re-identify as having a prevention mindset. So we're now working with a population of focus, a cohort of young people in community that have not yet become eligible or appropriate for our service. We're moving kind of into that framing. And this has been a 20+ year journey in California, at least for our welfare folks. And I think our behavioral health folks are getting there as well, but it really does require a mindset change to get to the culture stuff. I love that, Michael. Thank you. Any other thoughts about obstacles beyond the financing and the data and the organizational culture heft, the change that's required there? If not, we can transition. Cheryl, other thought there? Or no? Okay. While we pull up the next slide, I do see a hand up. Mary, can we check in with you? Is that an inadvertent hand, or do you have a question you'd like to pose to us? Okay. All right. We've already hit on some of this, but would love to maybe focus in a little bit. 3 ways of asking, I think, the same question, right? What are the benefits of alignment? Why should we, as managers and leaders, system developers and organizers, be pursuing greater levels of prevention alignment work? And maybe a little more specifically, then, what is the return on investment, either financially or in terms of the programmatic impact on community? Any reflections on any of these? Cheryl, can we start with you on some thoughts here?
Well, I gave the earlier example of the whole CalWORKS leakage investment, and we're starting to see returns on that. But, thinking in terms of, when you think about cost avoidance, it's like how much, at least in the child welfare world, how much we spend for kids in care if we take and redirect that same money to the families. How much of it cost avoidance and how much effectiveness would that be? Because we're looking at guaranteed income programs to, lift people out of poverty. And I know that that's been an initiative too here in California. So starting to see, the data and benefits of that in terms of stabilizing families. So there's still opportunities, I think, for people, and it goes back to the earlier conversation about mindset. If you look at budgets, it's like the measurement. They say the money is where your heart is, where your treasure is. Look at what government structures are at the local level, or what are they spending their money on? When you look at the children, and you look at families. We have child abuse prevention councils who or aligned with their local board of supervisors, but how much of that money goes to that actual council to do some of that primary prevention awareness work? So there's some ways of looking at where you target your money to get those returns early. And we've always said high end money. If you redirect it early, you certainly will avoid some of those higher end costs. And so that is just some of the things that I think we're starting to see some of those shifts with Families First, having the ability to take money that was typically used for just placement now to be used for services is a great opportunity when you think about diversion and return on investment. So those are some immediate thoughts.
Yeah, thank you.
I would love to talk a little bit about return on investment. Following up on what you had just said, Cheryl, is that in some of the early adapter states of Family First, like Kentucky, we're seeing quite large savings in out-of-home placements. And that's due to both the congregate care reduction, but also just a declining number of children in care. So as they increase funding in prevention, they're seeing a more significant decrease, savings from their out-of-home placement reductions. I think return on investment can be seen in many different ways. I think you can see it based on like just the numbers. So I think there's been a lot of research and there are a lot of studies even in our economic and concrete supports deck that show that if you invest in families early, you will have a significant long-term savings. For example, there's a lot of research, I'm sure many of you are familiar with the research by Heckman on high quality early childhood care and education, significant returns on investment over generations for whole families. There's also been some really interesting analysis of the enhanced child tax credit that we saw last year to families and what would happen if we actually kept that going. And so we're seeing some analyses that show that what you invest in that could result in like 9 times worth of savings over increased health, longevity of families, lower criminal legal costs, significantly reduced funding in child welfare. So, we have all those studies that show, like, just from the money point of view, what we can save in the future. But I think we also have to think about return on investment in terms of what does it do for families. So if you're better resourcing families, you're keeping families together, hopefully. And the return on investment is avoiding the trauma of family separation and that intergenerational trauma that continues and the cycles continue. Another way to think about return on investment is also for your own workforce. I know that we're seeing kind of critical workforce shortages across many of the state agencies and in child welfare in particular. And I think we need to think about the secondary trauma that workforce faces every day from separating families and not being able to support them in the way they might like to. And so I'd like us to start thinking about the return on investment for our own staff and hoping that we can think about it very broadly.
Yeah, Yasmin, that's profound stuff. We could probably spend an hour or more just talking about the impacts to workforce and the job satisfaction levels that would go up, right? If we can actually invest in prevention and be able to measure that on a case-by-case individual basis for practitioners and interventionists, that's wisdom, seems to me. Michael, thoughts from you around benefits of alignment or why planners and leaders should be focused on it?
I mean, I feel like the points were hit. I'll just say I'm just struck by the workforce one because I hadn't fully processed that. So it just was that's just a powerful one. And I think long-term, the broader community impact is around trust too, right? So I just think there's just a thing around systems and community, particularly communities of color, where there's just that lack of trust, and so we'll talk with a lot of work with systems folks who are like, hey, we're trying to do X, A, B, and C, and we can't get anybody to engage, right? And so there are these narratives we all have about each side. And so how in creating this alignment, which as I'm thinking about it, speaks to the shared values piece and some sort of participatory process in some ways. It depends where you are, but you're engaging in a different way with in centering this as much as possible with the families, with community. That creates trust. And so again, when you're able to develop that, our belief is, and that also helps you get to the real transformation. Because you're creating real sustainable change in a different way, right? That over time, these strategies, everything we're talking about, become the real prevention strategy that create wellness in the community. It looks very different. Because one of the things we keep bumping up against, and this is on the child welfare side, on the justice side, there are great examples of really good work happening. But when you go to Kentucky and you go to Louisville and you go to Newburgh community, there's still issues that they're dealing with. When you were in Santa Cruz, California, and Watsonville, there are still issues they're dealing with that are around the wellness that we're all trying to address. So again, it's just, hopefully this makes some sense. These are all these strategies that I think at the end of the day, we're trying to get to for communities to be well and the well-being of communities. And so the alignment helps that process, and I think helps develop a trust that looks different between families and communities and systems.
Yeah, thanks for that. Underscoring this whole conversation around return on investment is the long-standing dilemma about how do you monetize investments, right, in a way that captures what the return on investment is for prevention. We of course have just the really groundbreaking monograph in California now that's a couple of years old at Safe and Sound in San Francisco. Katie Albright and her folks have done this extraordinary work on county by county basis of just what the costs of intervention is to both community and to organizations. So if folks are not familiar with the monograph, I think they just updated that in the last couple of weeks. There should be an updated version to that really profound work out of Katie's shop. I'm also wondering if we can reflect for a moment or two longer on this idea of workforce impacts, Yasmin, that you introduced. I think about the now 2 decades long desire that so many folks have in our worlds, I say that collectively, around developing trauma-informed systems, right? And so beyond trauma-informed care, how do you make the organization trauma ready? And recognizing maybe the interface or the opportunity to deepen that work so that it's not just a conversation around how do we preserve our scarce workforce at the moment, but how do we develop an organization that is kind of trauma attuned or trauma aware? So any thoughts from any of you around kind of deepening that and the connection to being sustainably trauma attuned?
Other than to agree with you, I think that's the struggle that we're all recognizing that sort of came to realization during the whole COVID thing, and the impacts on workforce, and there's more work that we haven't done that we need to do. So I think that's an acknowledgement that especially your social workers doing that during COVID. A lot of times we're necessarily considered first responders at first. So it's just the recognition of who they were in the world, and then just having them not come back to work because a lot of the things around wellness sort of bubbled up, and how much they really were traumatized in the work that they do, and not having a place to land to support them, in doing that work. So it really opened our eyes about workforce development and what goes along with that for their mental health and their wellness as well, with the people that, while they're interacting with the folks that they serve. So it's a huge area that really needs a lot of a really close look and at how we address that in the long term.
Thanks, Cheryl. All
I
right.
just want to add one thing about that is that Family First also requires kind of a trauma-informed, trauma-focused organizational structure as you implement and provide approved services to families. And so I think there are a lot of opportunities there as well to kind of expand the thinking about trauma-informed systems.
Yeah, thanks, Yasmin. Really, really good point. All right, Kelly, let's pull up, I think, what may be our last set of questions, beginning to think about kind of concretizing or sustaining, if you will, the mindset and the practice, both policy and practice. The questions for you to ponder on, and maybe we'll turn to Cheryl here again to lead out, is how do we make the alignment and interagency work the norm? How do we make it stick? So much of the reform work that we do in California seems to be focused on kind of hurling resources against the wall and hoping something will stick. What can we do to enhance this effort? Same question, how do we systematize and sustain specifically the revenue sharing agreements? We've talked about that a little bit earlier, but what are your thoughts about either of these two questions, Cheryl?
Well, I think we alluded to some of that earlier. I just, to the mindset comments that were made, I say we transform first, not renorm, because sometimes I think folks call their transformation work, and it really isn't. It's like reworking the same thing and they wonder why it doesn't work. There's a whole phrase for that. But we're starting to see, some of the counties, reevaluate and assess their government structure and looking at how they, set up their funding and, how they pay their providers. Some of us are starting to look at those kinds of systems and see if they can, remove some of those barriers. You see the opportunity emerging now with counties that are going through the process of preparing their comprehensive prevention plan, which, requires them to assess some of those structures and map access and sort of figure out where the gaps are and where they need to align some of the supports. So you also see that developing, the work developing, and these are sustainable activities too that we're looking at. There could be systems and our ideas that they will be able to sustain themselves. So I see 2083 as being a vehicle, the systems of care work to be able to develop those MOUs to sort of outline sort of those shared values and shared fiscal dynamics that need to be articulated in some kind of agreement that everybody can sign on to. And then I think the accountability, setting up a system that really does true accountability and a quality assurance that bakes in the voice of folks from the community and lived experience. To me, once you invite the community in, you can't invite them out. So, it's like, let them hold us accountable for the things that we promised and committed to. So I think those are, that is part of the requirements of what we're doing in our prevention system, is make sure that there's good CQI and good, quality assurance work to hold people accountable for outcomes. I think also, you said we've been in the trenches doing a lot of this work for a couple of decades, expanding the relationships and the structures that have been set up for a long time implementation with wraparound. Wraparound is sort of being baked in on the part 4, and then it has an opportunity on the Families First end to look at wraparound, which is a very interagency cross-sector approach in terms of how we care for kids and families. So I think those are just some ideas around the areas that we have momentum going. And as I said, it's just transformation work will take time, but we have our foot in the door with, at least with the prevention work and then the overlay of being willing to really address the structural racism first and foremost, because that has to be addressed, regardless of what we do around some of the other areas. That you just can't do this work and not do that work too. That Michael talks about a lot.
Cheryl, thanks for that. I wanted to reflect for just a moment before we turn to Yasmin and Michael on these questions that I think the state deserves a lot of credit for your most recent guidance on the comprehensive prevention plan work. That state letter is just very thoughtful in terms of calling out the backbone architecture of the system of care 2083 work as being the collaborative through which you do that CPP work, that comprehensive prevention plan. So I think the state really nailed it. Your department just nailed it in terms of just that interface, right? Of not being able to do a good plan unless you've got your partners in collaborative where you can share the money, deal with the data issues, and try to get to something that's impactful in terms of sustaining. So it's really well done. Yasmin, thoughts around sustainability and concretization of this effort?
I just wanted to say first off that I very much agree that the comprehensive prevention plan is a wonderful and thoughtful vision, I think, to move us forwards with prevention and the ability of counties and localities to use some of that state block grant funding beyond just the family first prevention services, which are only a few compared to perhaps what families need, and particularly culturally responsive services and supports. And I'm hoping that counties think innovatively about how to use that funding. For example, I'm going to turn to Kentucky again. They provide $1,000 in flex funds for every family who's subject to potential removal. Because what we're seeing is families, if they don't have their basic needs met, they're not able to engage in those services. They're not completing those services. And so first you need to stabilize the family, and then they'll be able to benefit, I think, from some of those targeted services. I think I would also be remiss if I did not point out that California still has a very significant child poverty rate. I think we're at 25%. And I think until that is addressed, problems will remain. So, I mean, I'm hopeful about the future and about sustainability, but I want us to also be mindful that we have a very high child poverty rate, especially among families of color. We have incredible income inequities and inequality across the state. And we have a housing crisis that I think we can all say is a humanitarian crisis. And until some of those problems are solved, which are beyond child welfare, I think there'll be major obstacles, because we know that housing instability is one of the main drivers of child welfare involvement. And we know that that affects communities of color for all the reasons we've discussed in particular. So I do want to emphasize that there are big issues. And, you had mentioned, Richard, that California has the benefits of all this funding, and we got significant federal funding recently from the CARES Act and from ARP. But I think it's also about how we decide to use some of that funding to build sustainable systems.
Beautiful. Yeah, thanks. Michael, thoughts on sustaining and concretizing the work?
I don't have anything else smart to say after my two colleagues on this panel. No, I think everything that Cheryl and Yasmin said, and I just, again, because I'm not a practitioner in ways that, like Cheryl's, what she told me, these specifics. Zooming out for a second, that first question specifically for me, how do we make it the norm? So at the end of the day, some of this is an adult choice. As I saw that question, I was like, right, I'm like, it's kind of rhetorical to me, but it's kind of very real, right? We've chose to operate in ways we operate. They're choices. I give the example of free school lunches. I'm in Georgia right now. I live in North Carolina. Our office is in California. All I know is when COVID happened, somehow magically every child got free lunch for 2 years. We did that. It was possible. I'm in Atlanta right now. I went to Morehouse College. My dad lives here. I'm not here all the time. I came in the city right now, and I'm in an area that 20 years ago nobody would be living, and I'm in an Airbnb. So we know it's possible, and so I'm being hyperbolic intentionally, but I do think some of these questions we actually have to throw back to ourselves and ask, yeah, right, like why we're making a choice. And that some of this work, it is, when we talk about values, I'm just telling you, I've seen groups go through this. It's just a different conversation. It forces you to not think about our jobs as tasks and sort of just moving widgets, but really like, why are we doing this? And I don't mean that in some woo-saw, we all gonna just chill out. I mean, really like, why are we doing this? And to push ourselves in real conversations, leadership, and I don't just mean to be executive director, but really like engaging everyone in these conversations organizationally, which is extra work. It's gonna feel like extra work. And what we say is not extra work, it's part of the process of how you get the transformation. So my plug for this is I think California, the reality is California is generally things flow, right? From the West Coast, East Coast, in law and policy and practice. And so there's an opportunity right now. And I just will finally close for me with, in Los Angeles, we're working with, on the justice side, there's a reimagined, youth justice reimagined. There's also a reimagining the child welfare system. Those two sides did not know they exist. There was no communication for a period of time. There's an opportunity in California to impact two of the biggest systems, human resource systems in the country, and folks weren't intentionally talking at first, right? So I'm saying all of this to say, and then I'll step off my soapbox. Is it really, some of this is for us to engage in very different conversations and understand those conversations, making this the norm, doing that work, is how you actually get the transformation. It lets you address all the technical issues, and I don't mean technical to minimize, I mean like all of the practice issues and policy issues, but I think we just can't avoid some of those bigger conversations at the leadership and organizational levels to help shift culture.
Michael, happy to have you be on that soapbox as long and as often as you'd like to be. It's a good place for you. Thank you for that. Cindy in chat, thank you for calling out the Family First Prevention Services work and the CPP being the container, if you will, to bring other social determinants of health resources, supports, services, interventions to the table. And in California, I would just elaborate a little bit on Cindy's chat reflection that underneath the Assembly Bill 2083 work and that memorandum of understanding that's required in the systems of care, we are seeing some counties take the additional step of inviting their non-obligated departments into the system of care. So they're reaching out to public health, to other aspects of the human assistance agency, to pull in those partners in to be part of that backbone underneath that 2083 work. Effectively doing what you're suggesting is kind of structuralizing, if you will, the relationships to hold the collaborative effort to get upstream, way upstream to things like housing and employment as interventions and supports that are needed. Cindy, thanks for that. All right. Let's go back to the deck and just make sure we've exhausted all of our inquiry and turn for a moment to our participants and invite either additional questions or observations in chat or questions, of course. And if you'd like, you can also come off of mute. If you want to raise your hand, I think we can unmute you if you want to pose a question directly. We'll give you a moment or two to ponder on that. All right, seeing no hands and no additional questions in chat, let's turn back to panelists for any final thoughts from any of you on this topic in general, or are there things that we may have glossed over a little bit that you'd like to reemphasize? Final thoughts for us. Yasmin, can we turn to you first?
Well, not sure what else to add. I really agree with what Cheryl and Michael said. And I think we did see what was possible under COVID when it impacted everyone. We saw huge amounts of money being provided to families. We saw, and what seems to be the case, is a decrease in maltreatment, although families were economically unstable and faced significant job losses. What we're seeing is that child maltreatment seems to have declined. And so the enhanced government assistance seems to have served as a protective factor for families. And so that I hope going forward, we continue to think that way, because we can't get stuck in the scarcity mindset, because we know what's possible.
Thanks for that. Michael, any final thoughts from you today?
I think just let's push ourselves. I think, there's opportunities here, and I just hope that transformation and reimagination don't become these sort of played out terms of art that 5 years from now we're like, oh yeah, that was really great. I don't want to do that. And we're at Burns, we're really we're fighting ourselves, and that don't come from some holier than thou. This is the battle. Like, let's go and let's figure out how to really, but ask ourselves why we do what we do and what is our goal, right? And to push ourselves. And so I'm looking forward to California having, helping move the country and lead. So appreciate the time with you all.
Yeah, thanks. Cheryl, what final thoughts are in your head?
Just agreeing with my colleagues here on the panel. But just to emphasize, we just have a tremendous opportunity to really increase our capacity for this true integration, collaborative work. Just in all my years, we get right at the door and not quite get there. I think we are further along than just the foot in the door now. I just really need to put both feet in the door and go, and be willing to do the work. It's hard work, but I'm hopeful, and I think that the intangibles of seeing families well at some point, that we can provide more holistic models of care, just and to Michael's point too, is just like you hear words and like, are these the words of the season, or is the mindset and the work really going to continue and sustain itself? That is my hope and vision too. I think California does have a tremendous opportunity to lead the way, so that we can work toward that whole child, whole family, and whole community approach. So this was a great panel today to just have this dialogue. So thank you, Richard.
Cheryl, thanks. I appreciate that. And we saw in chat just a moment ago, Jeffrey offering observation, I think affirming kind of what we're concerned about collectively, right? Which is that at the end of this pandemic cycle, even though we had programmatic changes that were demonstrably effective on the micro level, how are we to sustain it? That's the question we've been wrestling with here at the end. So Jeffrey, appreciate you reminding us that we have to figure that out. We've got a well-intended legislature in California, and we've got folks that are willing to put their money where their mouth is, so to speak. So we'll just continue to do our advocacy work there. Yasmin, thank you for posting your updated documents into chat there for folks. And hope that you as attendees have appreciated the time today. And if you'll join me with an expression of appreciation to Cheryl, Yasmin, and Michael for their time and expertise today. We've been blessed to be in your presence and to share the conversation with you. Thank you all very much. And I will yield back to Franny to tie us up with any final logistics and ideas around posting of the webinar, when folks can find the resource.
Thank you, Richard, and thank you to all our panelists this morning. I appreciate your time as always. So this is, again, our final day, and thank you everyone for joining us this month. So just to close up, we will be sending out the recording as well as a survey on Friday. So we hope that folks will take a look and also complete the survey. Thank you everyone for joining, and we hope that the series has been informative, and we look forward to working with all of you in the future. With that, we close up. Thank you, Kelly.